This is Africa News Tonight on the Voice of America.
We start with our top story. Shortly before the show, I heard from Eric Kawa, a reporter in Brazaville who is monitoring the World Health Organization Regional Committee for Africa's 74th session. I first asked Eric to tell us about the purpose of the meeting, who the participants are, and the key points on the agenda.
The WHO Regional Committee meeting in Brazaville focuses on enhancing Africa's health leadership and, of course, looking at collective voice to actually achieve the Lusaka agenda. Now, the Lusaka agenda is one that is talking about health initiatives, building upon the feature of these initiatives and processes that are aimed at improving effectiveness of global health initiatives in supporting country-led health priorities and universal health coverage. So the purpose of this meeting actually has to also do with reviewing and strategizing health policies and prioritizing the African continent, and there have been discussions about implementation of the Lusaka agenda and, of course, the implications for global health initiatives such as that of the Gavi, the Global Fund, and the Global Financing Facility. And participants actually came from different countries here, talking about delegation. It includes health ministers from different countries and stakeholders from global health initiatives and partnerships that are also including that of the RBM partnership to end malaria. So for the key points that have been discussed in the agenda so far, the regional health leadership has been discussed here. That has to do with building up and ensuring that there's unity in pursuing this particular Lusaka agenda.
We understand someone was nominated to become the regional director of WHO, and this is what Eric had to say about that.
Appointment of the WHO regional director is also a key highlight of this particular event, where Dr. Faustin Engelbert Ndugulile from Tanzania has been nominated to become the next WHO regional director for Africa, succeeding Dr. Matshidiso Moeti. And then his term is set to start in February of 2025. And Dr. Ndugulile has a background in health policy and community development, and he aims to work collaboratively with member states to address regional health challenges.
And lastly, I asked him about Mpox, which is a major concern on the continent, and what is being said about that issue.
And definitely there are concerns about the Mpox, which is also a key topic that has been looked into at this particular regional meeting. So for the RBM partnership to end malaria, this is also one key body that is working towards this malaria project, and they have stated, and we'll be having a press conference tomorrow that will be addressing some of the issues around Mpox and that of the malaria precisely. So they have stressed the need to increase funding to combat malaria and to address related health disparities. The partnership also has emphasized that malaria is unacceptable justice, according to them, I quote, due to its impact on African health systems and economies, and they're also advocating for some multi-sectoral approach to tackle the disease effectively. So overall, the meeting has actually served as a platform for setting the regional health priorities.
That was Eric Kawa reporting from Brazaville.